A few years ago, I probably would have said, yeah, we don't really know. I've had patients who have been in chronic pain for 10, 15, 20 years, and we still see really, really outstanding results with them. So it's not that if we waited 10 years, you would no longer get a response. In the last 18 to 24 months, there's been a lot more research on the healing environment in the areas of injury and with certain cells called senescent cells. So these are cells that have stopped replicating, but they don't kill themselves through a process called apoptosis. And these cells now secrete inflammatory cytokines and things like that. And so what we are starting to see with the research is that areas of injury and areas of degeneration have much higher levels of these senescent cells, and that these senescent cells accumulate over time. And so I think that part of the reason why we might see a slightly diminished response in people who have had a chronic injury for 20 years versus 1 year. But again, it doesn't mean that they're not going to be effective. And we actually now have some different tools. There's some different approaches. So fasting is one way that we can help to remove some of the senescent cells. There are some medications and peptides that we use that can help reduce the amount of senescent cells. And so we are starting to really incorporate that over the last 6 to 12 months in our practice, where we're recognizing that, hey, there's probably a lot of these inflammatory producing senescent cells in an area of chronic injury. How can we deal with those before we go in with something like a stem cell procedure? So that way the stem cell procedure is actually more effective. If you decide to wait 10 years, I can't even imagine where the field of stem cell therapy is going to be in 10 years and, regenerative medicine. But that being said, the sooner the better for treatment. If you've obviously exhausted other treatment options, which it sounds like you probably have, and as opposed to, just waiting it out and continuing to suffer.